Today we'll be discussing mostly about how to take blood sample. Okay, because we are going to deal with the bloodstream infections. You will understand that properly in the lecture series. But today I'll tell you in brief what exactly bloodstream infection means. See, when it could be of two types. Whenever blood comes into an action, there is supply to every organ. So is it possible that some organ is getting infected first, any system is getting infected first, and then the infection is going into the blood? Is this possible? Yes, it's possible, right? How is it possible? Any common example of infection? UTI, urinary tract infection, very common. Other examples you tell me? Respiratory, gastro, so through them infection can get into the bloodstream. Okay, and primarily any of the heart's layer getting infected at first. Okay, myocarditis, pericarditis, endocarditis, anything. Okay, this is the two-way. Then based on the microbiological aspect, any causative agent, fungus, parasite, bacteria, virus, they are named as, when they come into the blood, they are named as Bacteremia, Viremia, Fungemia, Parasitemia. Okay? Emia word is derived from Greek. It also means blood. So whenever there is infection in the blood, because of these causative agents, we'll name them as these. So if you find any patient with Candidemia, what will the patient have in the blood? Candida, very good. Okay. So, do you know any names of any bacteria? You can tell me any common names. Okay, Mycobacterium causes TB. Okay, and common names for UTI? E. coli, Escherichia coli, and Treponema pallidum causes what? Syphilis, and causes leprosy, and Streptococcus pneumoniae. Okay, can cause pneumonia and don't know. Okay, and you're saying something? Salmonella typhi. Okay, these are all bacteria names that you know. Okay. What about viruses? Okay. Okay. Just say whatever you must have read it in newspapers also. Huh? Okay. What about rabies virus? What about hemorrhagic fever virus? What are the names? People who travel to other countries take vaccines. Common in the mosquitoes, prone areas. Dengue. Okay. Yellow fever. Okay, all these. Okay. What about fungus? Candida and Cryptococcus. Okay. Cryptococcus affects which system commonly? Can cause meningitis and respiratory disorders also. Okay. What else? Aspergillosis, mucormycosis. MBBS is not fungus. We are talking about fungus. Anything? Mucor. How was penicillin invented? Okay. What about parasites? You said something. Filariasis. So you understood the concept, right? So when there is bacterium in the blood, but it's not multiplying and not causing any harm to the patient, it is named as bacteremia. But when there is visible manifestation, when the bacteria is multiplying as well as releasing the toxins, which can cause harm to the patient, it is named as septicemia. So there are two terms that you will need to understand. One is sepsis, one is septic shock. Sepsis you can say that it's a multiple organ dysfunction. Okay, and when it's not curved, it can lead to septic shock when there is a need to resuscitate the patient's hypertension. Even after you are giving the patient with ample fluid, he is not able to retain the systolic blood pressure. His respiratory function is not proper. He's into mental disorientation. All the organs are failing. Okay, it's a hazardous state. So there is something called as qSOFA score. Okay, what is it? Have you heard of this term before? Nowhere. Okay, it's like systemic organ failure risk assessment. You have to remember three things. First is respiratory rate more than 22 per minute. How much? More than 22 per minute. Systolic blood pressure less than 100. And GCS less than 15. What is GCS? GCS सुना होगा, Glasgow Coma Scale. Or you can just remember it as altered mentation. Three things you have to remember. Any two of these are present, it means patient is at the risk of septic shock. Okay? So, after this, how will you diagnose if the patient's bloodstream is infected? You understood that from any other organ patient, we can get the infective organism in the blood, even if it's meningitis or pneumonia or UTI or any GIT disorder, you can find the organism in the bloodstream. So what will you collect? You will collect the blood sample. Do you know how to collect the blood sample? Anybody has taken a blood sample? But first thing is, what will you do with the blood samples? For what do you collect these blood samples? Serum. With serum you will see what? Will you see that in serum? No. Serum mein kya dikhega? Why will you not collect the whole blood sample? Is raised. So you mean you want to do the CBC, complete blood count of the patient's blood sample. What else can you do? You can go for any inflammatory markers such as CRP, ESR. You can go for any serum electrolytes. You can check patient's platelet count, CBC, erythrocytes, neutrophil count. What else can you do? You can do the liver enzyme tests, ALT. You will see LDH. You will see sodium, potassium, chlorides, all these. Okay. But will this give you an idea of the infective organism? No. For that, you will have to do blood culture, which comes under microbiology. So, to do blood culture, do you have idea about how the culture is done? What do we do basically? Do you know about the culture media plates? Do you know about the culture media and all that? You have been taught about it? Okay, name any media. Nutrient agar and blood agar, मैकॉन की अगर कुछ बोल हाँ ठीक है हाँ ओके तुम बताओ एक हाँ broth means liquid, agar is mostly solid. You tell me one. Okay. ठीक है तो so for blood culture specifically, just remember that mostly BHI broth will use broth, or there is biphasic medium which has the slant and also the broth. That's why it is known as biphasic. In this, we will inoculate patients. We'll take the blood sample and we'll use these agars and this broth for this. Blood agar we'll use for inoculating after we have put the blood sample in BHI broth. ठीक है, BHI क्या होता है? BHI is brain heart infusion. What do you understand by brain heart infusion? Mostly acquired from porcine or bovine, from cattle or pigs. We acquire this. It provides with the optimum nutrients to the organisms to grow. Okay. So after inoculating blood into this broth, first thing first, how will you collect the blood sample? From the vein, okay. What if the patient is having central line? You know what is central line? Central line is something that connects with the bigger veins. It could be subclavian vein, could be internal jugular vein. Why is it utilized in the patients? Firstly, when the patient is in the hospital for prolonged time, it is not possible to maintain the peripheral lines because there is chance of getting clots, swelling, thrombosis, etc. That's why we insert the CBCs to the patient. Okay, then you can infuse with the TPN also. You can give blood products also. So there is multi-lumen catheter which you can use in the patient through single line. If there are so many products to give, medications, blood, TPN, etc., it's not possible to insert peripheral lines, too many lines at a time. Okay? This much you understood? Any questions about this now? How will you take a blood sample? First thing I told you about the media. This media has something called as SPS. Sodium polyenethol sulfate. Why do we need SPS? What will happen if the blood gets clotted in the medium? The organisms won't get released properly in the medium, they will not grow. That's why we need anticoagulant. What else is there in the blood? In the blood there could be bactericidal products such as complement, etc. So this blood needs to be diluted so that the bacterium grows. Okay, 2 points. Whatever I'm teaching you now, you're going to ask each other later so that you remember. Okay? So these 2 things you have to remember. Then, how will you take a blood sample? To take a blood sample, we'll use 2 disinfectants. Why are we taking disinfection? Why are we doing skin preparation for taking blood? To prevent any skin flora to go into the blood culture bottle, because you don't want the skin flora to be growing. What do you need to know? You need to know about the infectious agent which is there in the blood. If the skin flora is going there, it will grow, it will be a false positive test. So, how will you do it? First thing is that you mark where you have to take the blood sample from. Usually, blood culture bottles are collected in 2 sets. Okay, one for aerobic, one for anaerobic. If central line is not there, you can prefer 2 separate venipuncture sites. If CV central line is there, one from central line, one from peripheral line. That's how you should do. Okay. So how will you do the skin preparation? First, you will have to wipe the skin with 70% alcohol. Why are you using alcohol here? And why, have you ever thought about why 70%? Why not 100%? Have you noticed alcohol evaporates? So if 100% alcohol is there, what will happen? It will get evaporated before its action. For any disinfectant, you should give it optimum time to work, right? If you're just wiping it and throwing it and then inserting the syringe, it's not gonna work. Okay? So for alcohol, you should wait for 30 seconds after you have applied, clean the surface area. Second thing, it will just remove the dirt easily if it is there. Okay? Plus 30% water in that alcohol will help you with the better penetration of any organism cell wall. Okay? So I told you 3 things about alcohol, why we are using alcohol as disinfectant. Tell me. First, why should it be used? Second, with friction, it can just easily remove the dirt and all. Okay. Third, penetrate the cell wall of the organism. Okay. So this is one thing. Second is, have you heard about chlorhexidine? Okay, it's another thing that we are using, or povidone iodine. You might have heard of betadine. Yes, it's a brand name for povidone iodine. So how much should you wait after applying chlorhexidine or povidone iodine? 1 minute minimum. Okay. Before doing this, should you wear the gloves? How many of you say that you should wear gloves? Yes or no? Yes. How many say yes? Okay. 2 people, 3, 4, 5. Everybody is saying yes. Okay, good. Before that, should you be doing hand hygiene? Why? Why are we told to perform hand hygiene before wearing sterile gloves? Gloves can breach. They can tear. Whenever you're performing any sterile procedure, you should wash your hands properly and then wear the gloves. Okay, since you're looking, this is also considered as a sterile procedure, taking a blood sample. You will wash your hands properly, you will wear the gloves and then you'll perform. Okay, after you have drawn the blood, how much volume is required? 8 to 10 ml in adults and 1 to 3 ml in, or 3 to 5 ml in children. It depends on the dilution. Sometimes in neonates, it's very tough to procure this much of volume. So, you have to remember that it should be in dilution of 1 to 5. Okay? If there is 50 ml BHI, then 10 ml of blood. Okay, this much you understood? How will you introduce that blood into the culture water? You will just wipe off the outer surface with spirit, and with the same needle that you had drawn the blood from the patient, you will introduce it, the culture water. Okay, this much is fine. After this, if you are not able to transport this culture bottle to laboratory, how will you save it? Where will you keep it? No. Why you should not keep it in the refrigerator? What is that medium doing? इसलिए तुम्हें उसको फ्रिज में नहीं रखना है, ठीक है? अगर इंक्यूबेटर है, you can keep it at 35 degrees. If there is no incubator available, you can keep it at room air. ठीक है? What other sample do you store like this? So just remember, like, just use the common sense. Like, if whatever sterile fluids you are getting, CSF and all, you should never put it in refrigerator for infectious causes. For if you're trying to find the infective organism and you're going to culture it later, you should not store them in the fridge because that will kill the organism, right? So you should store it at the room temperature if you don't have. But urine and stool samples and all you can store in the refrigerator because they are not sterile samples. Okay, what will happen if you store them outside? Maybe the pathogenic organism will die and the other organisms which were not harmful will grow. Okay, so that was about storage. Okay. Topic related to this. Have you heard about fever of unknown origin? Fever of unknown origin. When there is a fever more than 101 Fahrenheit at 2 occasions for more than 3 weeks with no known immunocompromised status and with all the possible diagnosis done, tests done, diagnostic tests done. When you're not able to come to a diagnosis, that is known as fever of unknown origin. Okay, what are the 4 things I told? First was fever criteria. Mm-hmm.
For 3 weeks,
Mm-hmm.
2 weeks, all the diagnosis.
Okay. 4th one. No known immunocompromised state. What do you mean by immunocompromised state? हाँ, किसमें होता है इम्यूनिटी कम? Patients with HIV, neutropenia, patients with cancer, patients undergoing cancer treatment, patients on immunosuppressions, okay? All these people. So what do you think can cause this fever? How will you come to the diagnosis? In the beginning, I told you about some tests you should run on blood. How will you approach? Would you want to find out the neutropenia hai patient ko, if neutrophilia hai? You will need to find that out. So you will run what? Complete blood count that will tell you about the hemoglobin status of the patient, neutrophilia, and there are many things I told you in the beginning. Any enzymes I told you about? Inflammatory markers? CRP, ESR. What else can you do? liver enzymes. Have you heard about molecular tests? PCR and ELISA. Any agglutination tests? Anything to do with radiology? How will you radiologically diagnose? Have you heard about X-ray? Have you heard about ultrasound? You will do all this to figure out what's wrong with the patient, to find out the causative agents you had stated in the beginning of this lecture. Okay. So, how can you describe FUO? Can you categorize it? Firstly, it can have infectious etiology. Secondly, it can have autoimmune etiology. For example, SLE, RA. So, to find out autoimmune etiology, will you do something? Any tests? Serological test? Have you heard about RA factor? Just remember all this, okay? RA factor in serology. Then I told you about, can any neoplasms cause fever? Yes. So three things I told. First is infective etiology, neoplastic, then autoimmune, and fourth one is undiagnosed. Okay, miscellaneous. So this is about fever of unknown origin. Okay. Since your lectures are not done, there is no point in detailing much about these things, because unless you study about the organism, you won't be able to understand the pathophysiology. Just burdening you with the names will not help. So I told you about the basic concept of how to take a blood sample. That is very important, because all of you will have to do this at least once in life. Even if you're not choosing any clinical branch, you will have to be acquainted with it. So just remember how to take a blood sample properly. Okay, and about bloodstream infections, you understood?